Scientifically speaking, we're sharing the view. From labs to clinics, breakthrough shining through, with minds that inspire and stories to unfold. Scientifically speaking, the future's being told.
Welcome to Scientifically Speaking with Christine on Oz Arab Media, where science meets real life and explore how everyday science impact our well-being. Before we start, allow me to thank Laurent Hair Salon for taking care of my hair today. But today's episode is all about something we all do, but rarely think deeply about: breathing and sleeping. For asthma and chronic cough, to sleep apnea and restless leg syndrome, millions of people are affected by conditions that disrupt breathing and sleep, often even without knowing the cause. Joining me today to shed the light on this topic is Dr. Paul Azzi, a specialist in respiratory and sleep medicine. With a deep interest in everything from lung cancer to parasomnias, Dr. Azzi brings clarity, compassion, and cutting-edge knowledge to the world of pulmonary and sleep health. Dr. Azzi, welcome to the show.
Thank you very much, Christine.
We finally made it, Doctor.
Yes, we did. It's been a long time coming.
We are so happy to have you on board. I would like to start this amazing topic today, yet maybe start smoothly. What made you choose this field? What was the moment that you made you think about, that's what I want to do for life?
Thank you so much.
No worries.
Going through medical school, you have a lot of ideas about what you want.
Yes.
And they, as you progress, it crystallizes into things that you enjoy doing, things that you see yourself doing for the rest of your career.
Right.
And I found that respiratory medicine, because there's not a lot of sleep medicine in the hospital as a trainee, but respiratory medicine in particular gave me, firstly, I found it easy to understand. I didn't find some other aspects of medicine that easy to understand.
Yes.
But respiratory seemed to be my calling for that reason, that was one of the reasons.
Yes.
And then you also get a lot of variability in your work. So you can sit down and speak to people in clinics, you can do procedures.
Yes.
The procedures are quite varied. There are a lot of investigations associated with respiratory medicine.
Right.
And for a long time, it was an area that saw static research, and that's been changing over the last 10 years, and it's become an area of hot interest in the research space. There are a lot of new drugs coming out. And on top of that, as you're going through, you have a lot of influence from mentors.
Yes.
And a lot of my best mentors were respiratory physicians.
Amazing.
So that was how I got into this field, and it was serendipitous. I fell into it because I've really enjoyed sleep medicine since getting into it as well.
We're glad that you liked this topic so we can tackle it together. And if you don't mind me starting a little bit digging into this topic, we all know someone who snores or always feels tired, right? How do you know when it's more than just a bad sleep?
It's a great question. I think that snoring is a problem in itself for so many people.
Yes, it is.
There are so many people that come to see me who have been dragged in, usually by the collar, by their spouse or significant other.
Tell me about it. We all have one that snores or sleeps loudly.
And quite to be honest, not to be not to just ignore snoring.
Yes.
Or to downplay it, it can play a significant part in people's sleep quality as well, just because of how it can cause arousals in and of itself.
Right.
Not to mention the effect on the partner.
Yes.
And snoring is usually a structural issue. It can be an issue associated with sleep apnea, and you can assess it quite easily in the clinic. So if snoring is a problem, it should probably be assessed. That's very important. How do you differentiate it from other sleep issues? Usually, snoring in and of itself is its problems are they're localized to that night or the series of nights where you snore.
Yes.
But if it's associated with a condition like sleep apnea, there are usually a list of symptoms which come with the package that are not associated with snoring.
But on its own, is it a chronic disease or is it a sign that there's something going on?
It should be assessed. It's not necessarily always a sign, but it can be
Right.
associated with significant sleep
Others.
apnea.
Right. Interesting. Thanks for tackling that, Doctor. Now, some people say that they do sleep 8 hours but still wake up exhausted. What could be going on in there?
It's a good question because it speaks to all of the issues that can be associated with sleep.
Right.
It's very rare that somebody who sleeps a good 8 hours
Right.
wakes up feeling tired and has significant tiredness during the day. If we take a couple of steps back and we look at what sleep is, how sleep
Yes.
comes about. Sleep comes about because of two ways, primarily. Because of sleep pressure, because the body is pushing you to go to sleep because of what we call homeostatic mechanisms. Essentially, it's
Right.
just
Shutting
We're-
down.
yeah, we've been awake for this long,
Yeah.
and the body's telling us through chemicals and neurotransmitters, okay, it's time to go to sleep.
Right.
And there's also the circadian rhythm system, which is an internal body clock that we all have,
Yes.
which is focused around the 24-hour period,
Right.
and that helps us regulate our time to go to sleep. And the recommendation is 7 to 9 hours gives you good sleep, and so 8 hours should be bang on for the vast majority of people.
Right.
Now, of course, that doesn't always work. If we look at sleep quality, so if the sleep quality is not great, if you're having disrupted sleep during that 8 hours, you will wake up feeling unrefreshed.
Right.
And by far and away, the biggest issue is sleep apnea in that category.
Right.
There are other issues which you mentioned in the preamble, like restless leg syndrome. Snoring can be a problem there as well.
Yeah.
But by and large, we are essentially looking at something that's disrupting your sleep. If it's going to be innate, the vast majority of the time it's going to be sleep apnea. There are other aspects around the room or even around the house or the neighbourhood that can impact somebody's sleep.
Right.
And there are other aspects related to chronic medical conditions and mental health and anxiety and depression that can also impact on quality
Oh, wow.
of sleep. And even in those circumstances, or even like significant stresses at work or with the family,
Yeah.
that can be a big
So it's
issue.
like you're
for people.
sleeping, but there's still something active in there, and that's why you might be waking up
That's
tired.
right. That's right.
Wow.
And then for the tiny minority where those issues are not present, they're still sleeping 8 hours and they're still
Tired.
waking up feeling tired and having other issues of tiredness. Then we look for primary sleep disorders in those people.
There's a lot happening in there where you don't really expect it. But we did speak a lot about, the snoring, the sleep apnea, the different syndromes that most of us really know, and I'm sure you have had in your clinic. I'd like to know if there are some strange or surprising sleep issues that you've had or seen in your clinic that most people wouldn't expect to have.
A strange issue.
Yeah, share with us some little weird maybe cases that happened.
Well, a parasomnia is usually the one that people go to, and I
Right.
think that's very strange. Now, most people see parasomnias as sleepwalking or sleep talking,
Yes.
but there's a lot of there are a lot of other conditions which are sort of listed within that realm of movements during sleep.
Okay.
We have a way of breaking them down in
Okay.
medicine, but it's not important for the conversation. But
Okay.
it can drive strange conditions where the person who has a dream potentially can act out parts of that dream in real life,
Wow.
and that can manifest in any number of ways.
So bring the sleep to real life. So you believe that you're now living it.
Yeah.
That's what you're trying to tell me.
Yeah,
Ooh.
so it can involve swinging bats, breaking doors, hurting other people, hurting themselves. Some of the cases I've seen have involved court cases because the person didn't realise what they were doing, and they were assaulting their bed partner or somebody else, and they happened to be asleep.
Wow.
That's the
That's
problem.
interesting, but like how you can merge both lives together, like the sleeping mode and the awake mode.
Yeah, listen, that's definitely right. And that's one aspect of when you're asleep and you sort of parts of your body are going into the wakefulness state whilst the other parts stay asleep.
Right.
But then the other aspect, the flip side, is whilst when you should be awake, you're actually falling asleep. And that can occur in strange scenarios. For example, you can be walking and talking, and then maybe you might laugh or have some sort of emotional impulse, and some people just collapse to the ground, and that's called cataplexy, associated with narcolepsy. Sometimes it can be more sinister, where someone is driving a truck or a bus or some sort of important
and then sleep suddenly.
automobile, and they can have a micro sleep, and that's something that people may be a little bit more familiar with.
Yeah.
But that's the perhaps less fun.
Yeah, of course. It's dangerous, actually.
Yeah.
But doctor, are these treatable or fixable or not? They have to live with them.
Well, parasomnias, we have treatments for some of them or most of them. We usually try to find out the underlying etiology, what's driving it. Even in narcolepsy, there are different underlying etiologies.
Right.
There are some deficiencies in a particular chemical which we can treat.
Okay.
And there are some other aspects to it which we don't necessarily understand yet, but we've got therapies to try to overcome that. So in short, yes, usually.
Usually we can. That is very interesting. Doctor, although this topic is really interesting and I'd like to maybe tackle it more, but we also like to talk about lungs. So give me the opportunity to ask you, what are some signs we know that the lungs might be struggling even if we don't feel sick?
It's a good question. Because no one is going to come and tell you or think about, my lungs. They're going to comment on other things that they feel, like breathlessness, coughing, chest pain. There are some other aspects that are also not as obvious. Weight loss and low appetite could be one. Coughing up blood is an important symptom as well that we look at. But and if we delve into those symptoms a little bit further, it could be as simple as when you're maybe walking from your car to your work and you think, that was actually a bit harder than what I'm used to.
Yes.
Or maybe you're walking with your spouse or maybe with your kids and then you're going up a slight hill and you think, well, that was a lot different to what I remember it being.
I'm growing old, usually I say.
Yes. And it actually may not always be that. And growing old, there are a lot of fit older people out there and they don't have these symptoms. And whilst it certainly could be a part of growing old, there's a real risk that it could be related to something else.
Interesting.
So you've just got to be mindful of what's normal for you and what's abnormal for you, whether that comes in any of those symptoms.
Right.
And if you have an abnormality or you perceive something is not quite right, it's important to go get it checked with your GP.
Amazing. Now, chronic cough is usually common in our community. When should we stop blaming the weather, and really get started, get checked?
Listen, weather's an important... I'm not going to blame people for thinking the weather's going to impact their cough.
It's really becoming weird, the weather nowadays, but still, we got to know.
Chronic cough, honestly, has so many different differentials to it.
Yeah.
A lot of people think it's a little bit of a dry topic, but it does affect a huge number of people.
Right.
A significant portion of people that come in to see me because of a cough that just does not go away. And the main groups that we're able to tie people into are people who've just had an infection and they are waiting and they have this lingering cough which can linger for weeks to months.
Right.
They can have a cough which is associated with an underlying lung condition such as asthma or maybe an acute infection, a chronic infection. Pneumonia, for example. You can even get coughs from upper airway problems, such as sinus problems or nose problems, which can also cause snoring. Sleep apnea in of itself can cause a cough. Anything that irritates the throat can basically cause a cough reflux is another huge cause.
Ah,
So if you can imagine with reflux, acid reflux, you've got your stomach. Usually there are at least two sphincters
okay.
to areas of blockage or folds that try to prevent acid from coming up into the throat.
Yes.
But in quite a few people in the community, that they don't work very well.
Oh.
And so the acid is able to break through, and
But
because
it's funny that it's coming with the cough.
yeah, so
Okay.
so because up here in the throat you've got the windpipe and the food pipe right next to each other.
Right.
As soon as you get even a tiny amount of acid or food content or any stomach content coming up into that area,
Right.
it can irritate the cords and trigger a cough.
Right.
Sometimes, not uncommonly, it can get into the airway,
Right.
and then that can cause other issues as well.
Right. So if I want to go back to my question and say, when can we get checked? Is it when it becomes unbearably painful, or when it extends the amount of time that it didn't go? Was it?
A large part of it's going to come down to recognizing that there is a problem.
Right.
A lot of people just cough and they associate it with, like you said, the
The
weather,
weather. Yeah.
or smoking or some other common cause that they think will either stay the same or eventually go away. And if it's something that's concerning you, if it's something that is outside of the usual, you should definitely get it checked out. We've got an semi-arbitrary line that we call a chronic cough. And it's if
Right.
you've been coughing for more than 4 weeks,
Better to be checked.
at that point we say you should get checked. But really it's as soon as you get concerned, or if anyone else thinks that there is a concern, maybe you're speaking over the phone
Yeah.
and you're clearing
interrupting.
you're clearing your throat, or you're coughing. Maybe it's coughing at night. Maybe it's coughing when you're a bit nervous, sitting in front of people, like doing what we're doing now.
Oh, that's interesting.
Then you need to get it. Then you need to get it checked.
Wow.
Yep.
How interesting. Doctor, you did mention asthma as one of the maybe could be reasons for chronic cough. But I'd like to ask, because we know a lot of, especially in Australia, a lot of people have asthma. Is it something you're born with, or do you acquire it along the way?
It's another good question. Asthma is a condition where the airways become quite inflamed.
Right.
And that happens in certain blocks, and it can give symptoms of breathlessness, coughing, chest tightness, but then it usually goes away. And once it goes away, you should be going back to normal.
Right.
That is what asthma looks like clinically.
Okay.
In terms of when it comes on, there definitely is a genetic predisposition in some people,
Okay.
but not in others.
Okay.
And we differentiate them by calling the people who have a genetic predisposition and who display symptoms early, usually below 5 years old.
Oh, wow.
But we just call it childhood asthma. And in those people, they're often associated with an allergic. There often is an allergic component there, and there often is a familial history there.
Right.
So, if, for example, if one parent has asthma,
Right.
the literature says that the child has a 2 to 3-fold increased risk of having asthma as well. And if both parents have it, the risk is ostensibly higher.
Interesting.
So that's the childhood asthma aspect.
Right.
People can grow out of that.
Right.
And so it's not necessarily an issue for them in adulthood. It can come back in adulthood, but the rates of it coming back are actually not that high.
Oh.
There is another group of people that have what's called adult onset asthma, de novo. So that's not, they never had childhood asthma, never had asthma
Right.
in their adolescence growing up,
Okay.
but then they get it out of the blue almost in their 30s, 40s,
Oh.
can even be a little bit later than that. And those people can be sort of less allergic and have different triggers that set them
Right.
off. Usually it's some sort of dust or fume or exposure. Can certainly still be allergic, but they are at this point in time distinct groups
Right.
which have the same condition. But I think potentially, if we delve into it a little bit further, there probably is a genetic predisposition for these adult onset people, which we haven't worked out for the majority of them.
Right.
Certainly a small subportion we can establish if there's a genetic problem,
Yes.
but the majority, we're not there yet.
So there's many groups of people having or acquiring asthma really that might take maybe another full show about that. So
We have some biomarkers that we've established,
yes.
and we've got some excellent therapies. Like there are new injectables out there which are very, very helpful, honestly, for the people that we're able to match to them. But there's still a way to go.
There is. Great to know. Doctor, I'd like to talk a little bit about our lovely community. We boast about smoking or vaping or the argile that we're known for in the Middle East. How does this affect our breathing and our sleep, even if we don't do it that much? It's just, socially I do argile. I shouldn't be worried. What's your talk about that?
I'm happy you asked me. I didn't see that on the list, but I saw.
it's okay.
I saw that. I'm glad to be saying this in front of the camera, because if I say it to a lot of people, they just roll their eyes. They don't want to hear it. And
Because it's not cool not to do ergile when we go outside. That's
that's part of it.
Yeah.
The other part is that they've heard it before,
Yeah.
and they're not ready to change.
right.
But if we have a look at cigarette smoking, the data says that if you're smoking 20 cigarettes a day for 30 years, then you put yourself at a significantly higher risk of having lung cancer and all of the associated lung problems. There is a 10 to 20%. So let's take all of the people that smoke,
Okay.
and this is what I tell them when I see them.
Yeah.
Let's take 10 to 20. Let's take all the people that smoke in the area,
Okay.
and they've been smoking for 20 years, 30 years, more than that. 10 to 20% of them are going to get lung cancer.
Oof.
So that's
High risk. That's a high number.
That's 1 in 5, 1 in 10. If we're talking about a household who smokes, that it's almost definite that one of them is going to get, one or two of them are going to get lung cancer. And some people might look at that and say, well, the flip side is 80 to 90% of us are not going to get lung
Good
cancer.
to be optimistic.
Yeah. And to that I say, this is just lung cancer. And if we take all of the other aspects of smoking, like heart disease, like strokes, like vascular disease, like COPD, which is smoking-related lung disease,
Yes.
and all of the other lung conditions that are associated with it, they're a little bit less common.
Right.
The risk of a major complication to your health from smoking goes up to 50%. And we're not...
We don't have much left from the 100% anymore.
Yeah, you can't talk about 80 to 90% anymore.
Yes.
You're saying that if you smoke, it's very likely then that something is going to happen. We say, when people get in cars and don't put on seatbelts, I think from the data, it's quite old now, but there's a 10 to 20-fold increased risk of having major problems from an accident. This is the same. This is even worse than that.
Yes.
From not wearing a seatbelt. So
even if we do it casually, not every day like the heavy smokers, doctor?
it's a question that we've got to be a bit nuanced about.
Yeah.
You're right, because if people smoke much less frequently, the chance of having major complications is going to be much less.
Okay.
But the main risk, which is what the drug companies know about, what the smoking companies knew about from many years ago, is that even just a couple of cigarettes have a lot of nicotine in them.
They do.
And so it doesn't necessarily stay at 1 to 2 cigarettes.
Yeah.
It becomes a physiological addiction
Oh,
where you want more and more to satisfy that addiction. And then on top of that, after you've gotten used to smoking, you get yourself into a routine. And so it might start off at 1 or 2, but before you know it, it's cascaded into
a
10,
habit.
10, 20 cigarettes a day.
Wow.
And this is an issue. It's this habit forming of problems like smoking, problems to your health that we see across the board. We see it in overeating.
Yes.
We see it in caffeine use. Some
Yes.
people who have sleep apnea, for example, and they have been self-medicating without having
We're all
had a chance to
doctors.
look at it.
Yeah.
They start with one coffee. They're at work. They
Right.
might go out for a lunch and they'll say, "Oh, listen, I need to have a strong afternoon, so I'm going to have this coffee to help me with that."
That really is funny. You're mentioning that along with smoking and the addiction or the habit. Because my next question to you would be, we're not taking sleep issues seriously in our community, and that's maybe because we have unhealthy habits in our community, like eating late at night, or having especially the Lebanese or the Turkish coffee, which is really strong. How would you tackle that?
Yeah, it's an important
Yeah.
question, and I guess it goes back to recognizing what's healthy and what's unhealthy. And if we go back to the caffeine question, I've had many people come in and they're drinking 8, 10 cups of coffee a day, and I ask them,
That's me.
Sorry. Oh, I'm going to say,
Yeah,
I
then
would
say
say to
to me.
people like you, how did we get to that level?
Yeah.
And then quite often, I don't think this is the case with you,
Yeah.
but quite often it starts off as, I just started with one, and then I felt like I needed more
Yeah.
and more and more.
Yeah.
And initially I blamed it on the lifestyle. Initially I blamed it on the quantity of work, on the amount of work.
I think that does apply to me.
Yeah.
Because you think like, oh, I'm too busy, but I'm getting tired, so let me just grab this cup of coffee. It will wake me up and I'll go by my day. And then you'll do that repetitively during
Yeah.
the day. Other than the social part where you want to really go out for, a coffee with your friends. So you end up really taking too much in.
And quite often that's actually all that it is that you need.
Wow.
Coffee has a stimulant which suppresses part of the sleep pressure.
Wow.
And so the caffeine suppresses that sleep pressure stimulant. So it keeps you going for a bit longer. And then you have the
Yes.
caffeine crash once it wears off, because
Right.
that stimulant's able to burst back into the space.
Bad habits, doctor. We have bad habits.
But I don't want to be too critical of
Yeah.
this kind of activity, because a lot of people do it. But it is important to be mindful that sleep apnea, for example, is present in the literature quotes 13 to 19%
Wow.
of the population. And so you could be self-medicating for this particular condition, which is associated with
Okay.
many other medical problems.
Right.
It's not the only condition that causes tiredness.
Yes.
And tiredness is not strictly, it doesn't have to strictly be related to sleep like what we discussed earlier.
Right.
But if you find yourself just needing more and more caffeine to the point where you're needing energy drinks,
Right.
needing a bucket load of coffee a day, then that speaks to the fact that it might be related to your work, but maybe we need to get
Affecting it.
other things
Yeah.
checked as well.
What about the heavy meals and our beautiful mezzas that can go to midnight and beyond, eating and munching on them?
It's an issue from a. I feel like I'm being very. I'm targeting.
No,
our,
you.
I feel
I'd
like
like it because we need to tell people it's nice to socialize, it's nice to go out with your friends and have these lovely cultural foods, but be mindful, maybe you are not sleeping, or maybe you are, having breath issues because of that. I just need a proof from a professional.
I definitely don't want to take away people's pastimes and what they enjoy. If it is an issue for people,
Yes.
that's probably the more diplomatic way to put it.
Okay.
If it is an issue,
Yeah.
it's because when we eat at night, especially late at night, that results in there is advice related to sleep hygiene where we recommend for people not to have any major meals, not to sleep on a full or an empty stomach.
Right.
And so that is part of, if you sleep on a full stomach, that the full stomach does predispose people to being sleepy.
Right.
But it can also predispose to reflux or even a little bit of discomfort in getting to sleep. And so we often say, don't go to sleep on the full stomach. Try to go to sleep on halfway.
Digested.
Yeah, somewhere halfway.
Yes.
If people are having reflux, we suggest waiting for 4 hours before going to sleep after your last meal or after your last drink. And so late night mezzas and the big Ramadan meals that people are having right now.
At the moment, yes.
That can cause a lot of problems with going to sleep.
Right.
So, I can imagine maybe you're eating late at 10 p.m.
Yes.
You've got your whole family over.
Yes. And then the suhoor. The suhoor happens like dawn time. So maybe they just want to eat before, they have to fast again. We understand that, but it is really definitely, hopefully, not too much affecting them.
Yeah, and I don't want to be too critical here.
Yeah.
I want people to enjoy life.
Yes.
But if we do that all the time, it's going to predispose to sleep problems. Very likely going to predispose to sleep problems down the track.
Well, doctor, obviously us as adults, we have very unhealthy habits, unfortunately, and we're hopefully looking into fixing them. But how can us being as parents tell our kids that our kids maybe are struggling, maybe they're looking into our habits and they themselves are struggling with the breathing, with the sleeping, with the lungs? How can we actually pick that up and help them?
It's a very pertinent point, because I feel like a lot of adults still have not gotten on top of how we do things.
Right.
We often let ourselves become overwhelmed with our work or other social stressors, and we forget to look after ourselves. And I think that's a very cultural thing. It comes from coming from a land which is war-torn, which has a lot of problems, and a lot of family and extra family issues. We've not really been accustomed to looking after our sleep, let alone the rest of our health.
Yes.
And that's why when we have a look at health outcomes for people who have English as a second language, just as a broad-based group, their health outcomes are generally worse. And we can theorise why, but I think a large part of it comes down to health literacy not necessarily being there, because they've had so many other issues to deal with. Now we're living in an environment where life is a bit more stable at this point in time.
Yes.
People have a little bit more predictability in their life.
Right.
And they're able to pick up patterns in their behaviour, and they're able to worry about their health a little bit more, because their health is now coming to the fore. You're much more likely to live to 80 now than what you were maybe 50, 60 years ago. And so that's coming into the community consciousness at the moment. I'll be specific here.
Yeah.
It's important to know what's normal for the child. If the child is gone from waking up feeling refreshed to waking up feeling tired and not getting themselves ready for school, their interactions, their mannerisms with you have changed.
Yes.
That can be a problem.
Okay.
It can be more subtle than that.
Okay.
It can be that they've hidden that aspect, or they've been able to mask it because they're strong or stoic, but their grades start going off at school. Or aspects of their lives outside of the house begin to fall apart. That's when you've got to look, okay, is there an issue with the sleep that we have to look at? By far and away, the most common issue is snoring.
With kids?
With kids. And so, and so a lot of people hear that and they take the kids to a paediatrician or an ENT surgeon to have a look at some of the more common causes of snoring. And then I think as we get into adolescence, we start seeing more of the fatigue.
Okay.
And that can be related to poor sleep hygiene, where they maybe need to sit down with someone and talk about their sleep routines. It can be more sinister than that, potentially non-medical related, something around
okay.
work, something around school, something
Yeah.
around friendships. It can be a mental health issue which we need to evaluate
Yes,
with the
wow.
GP or with a professional. And it can be something innate with sleep, like
Right.
sleep apnea. The youngest sleep apnea patient that I've dealt with is, I think he was 18 years old.
Oh, wow.
Yeah.
That
So
is interesting.
it's not strictly speaking a disease of the elderly.
Right. Well, it's obvious that stress and anxiety can be a disease to everyone, not only the kids or the adults. And we always hear it from our doctors, don't stress out, take it easy, try to sleep. It's easier said than done.
Yeah.
How much is really stress and anxiety affecting our sleep? Briefly, doctor, please.
They can be gigantic problems.
Right.
Yeah, really gigantic issues. It's one thing to be able to have an organic cause, to be able to find an organic cause,
Right.
like excess weight or like an enlarged adenoid, and be able to treat that for somebody and get rid of their
Right.
sleep apnea that way, or get rid of their sleep issue that way.
Yeah.
It's another thing to find a psychological issue that's impacting someone, because it's not just restricted to sleep.
Right.
It's probably affecting significant portions of their life,
Right.
right from their relationships with other people, their relationships and performance at work.
Right.
It can be really encompassing. It's an encompassing sort of problem. But thankfully, I think for a lot of people, it's transient.
Right.
If they're able to overcome it,
Yes.
then they're able to get past the issues that were associated with it. And so I would encourage people who have worries or concerns which they feel may be impacting their sleep. Maybe they're waking up in a little bit of a panic.
Yes.
Maybe they're feeling anxious around people. Maybe they're not performing as well as what they once used to.
Yes.
Maybe there is a known association with a problem that they've had in their lives, potentially a breakup or
Yes.
some other significant social stress. It's always a good idea to speak to someone about it.
Right.
It can be family, it can be someone from the community,
Yeah.
it can be a health professional.
Right.
I think the GP is one of the best ports of call, because it's from there you can be directed to the
to
help that you
different
need.
people. Yeah, that is amazing. Doctor, we've spoken a lot today about problems, issues, chronic issues. We need some action here. So what are some simple
There's not
habits?
been enough.
I know, right? What are some simple habits or changes you can advise us today to try and make our breathing easier or our sleeping a little bit better?
It's a very broad question,
know.
but I think that the best way to look at it
Yes.
for an individual is
Yeah.
to take stock of their life.
Right.
It's very difficult in this day and age to pause and think about what you need to do.
Right.
Even me, I've got so many people waiting for me to do something for them right now. So
Okay.
it's difficult. You're one of them.
Yes, yes. I need action. I need help right now. What
yeah.
can you do?
Yeah. I think the number one thing is to pause.
Right.
Just stop for a moment.
Literally breathe.
Yeah. Think about yourself. Think about what it is that you have been saying that you needed to do
Right.
for a long time.
Yeah.
Because quite often the answer is literally right in front of us.
Wow.
We know what we want. We know what it is that we need, but we just don't have time to do it. Or maybe we're not confident enough to get
Yeah.
it done. Or maybe there's something obstructing that particular process that we know we need to do.
Right.
It could be losing weight.
Yeah.
It could be sleeping at the right times. It could be sleeping for the correct number of hours.
Stop smoking.
It could be stopping smoking.
Yeah.
It could be changing jobs from that very dusty environment you were working in.
Right.
There are so many different aspects that you can see, and that's why the question is so broad based. It's difficult
Yes.
for me to apply
Of course.
to everybody, but often people know what it is they need to do, and if they take a step back and they do it,
They can see it.
I think that a large part of them will get over the problem.
Right.
And for those people that don't, that's when they go get some more help. That's why people like me exist.
Exactly.
That's what we've studied to try to fix for people.
Amazing. Before we finalize today, I'm sure there's a lot of people, they were listening to our conversation and they're saying, oh, that's me. So if this is really happening, what should they do next?
Talk to your GP.
Right.
Talk to the GP. That's probably the number one thing.
Right.
If you have an issue that you are aware of with your health, whether that's poor sleep, whether that's breathlessness, or whether that's any of the other symptoms that we've spoken about, it doesn't even have to be that specific. It can be any general concern.
Right.
Because your health is not a moment in time. Health is a long-term strategy.
Right.
To make sure that when we get to our older years, we have good quality older years that we can enjoy for ourselves, but also for our children and their children.
That's true.
And so that's where I think the crux of it is. It's taking the view, it's taking the mindset that our health is actually important.
Yes.
And it's not selfish to look after your health.
Yes.
And we are living in a time where we do not have to be fatalistic about what we have.
Yes.
If I have, like إذا عم شنخر مش ضروري ده الشنخر
كل حياتي.
مش
and
كل حياتي.
deal with it.
yeah. أو إذا عم أعمل سياستا.
Yeah.
إذا أنا بنام من بعد الظهر. It doesn't always have to be like that.
Yes.
You can look
Do a
at
try.
avenues to try to fix that.
Amazing. Doctor, I really appreciate your time being with us today. You really tackled important points about the science of breathing and sleep, and I'm sure it doesn't stop here. There's much more, but we have only a little amount of time to talk about so many. But I would like to acknowledge and thank you for being here today with us. So thank you so much.
Thank you for having me.
No
Thanks,
worries,
Christine.
of course. And to our listeners, before we go, if you're struggling with your breathing or your sleep, please do not ignore the science. There is help, there is science, and definitely there is hope. This is Christine from Scientifically Speaking on Oz Arab Media. Until next time.